Hello all and welcome to Physio TV classroom. Today's session we are going to see range of motion evaluation for lower extremity part 2. So in previous part we have seen range of motion evaluation for hip joint. Today we are going to see range of motion evaluation for knee joint and ankle joint. So myself Dr. Tushar Sathe, Assistant Professor in Sancheti College of Physiotherapy, again welcomes you for Physio TV for range of motion evaluation for lower extremity part. So as we have discussed, we are going to start with knee range of motion evaluation. For knee range of motion, knee joint is a hinge type of joint. So it has two movements, that is flexion and extension movement. So this flexion and extension movement happens at medial-lateral axis and sagittal plane. Okay, so for this, the knee movement action, that is, this is your knee joint. So proximally it has a femur which is covered by a thigh muscles, and distally it has tibia and fibula, along with anteriorly there is a patella. So together this is a knee joint and it has two movements, that is flexion, this is knee flexion, and from flexion to straightening of the leg, that is, this is called as knee extension. To check the knee flexion range of motion, firstly what we have to do is we have to take a subject in a supine lying position, and you have to make sure that the knee and the hip is in 0 degrees of extension and 0 degrees of rotation. So it should be in straight line, and initially the knee should be extended. You can take it on the couch as ankle is on the couch, or you can take it below the couch. Can you move a little bit down? Okay, this can be the ideal position for knee flexion range of motion. Now to perform a knee flexion, first ideally you should perform a passive range of motion to check what are the end feels at the end of range of motion. Okay, to do a passive range of motion, you will stabilize at the thigh with one hand and at the leg with one hand, and the therapist position should be in walk stance position, and then you will grasp and do the knee flexion range of motion. Here you will shift the weight at posterior leg, and here you can see this is the end range of motion. I am putting a passive pressure, but it's not going ahead. So here what I get is the two muscles, that is hamstrings and calf muscles, are approximating here, which is causing a soft end feel at the end of knee flexion. And from this flexion to the extension is a knee extension range of motion. So in ideal scenario, the normal range for knee flexion range of motion in adults is vary from 130 degrees to 140 degrees. But some research which has been proposed by authors which suggests that if the knee range of motion is greater than 110 degrees, which is also considered as a normal range of motion. Okay. Now, once we know what is the axis, what are the movements, now we will know how to place a goniometer to check the knee range of motion. So this is a universal type of goniometer in which we have a stabilizing arm, a movable arm, and a goniometer. Here this is the center point, which is known as the fulcrum. To keep a goniometer, we need three major references, that is where to keep the fulcrum, where to keep the stabilizing arm, and where to keep the mobilizing arm. Now we will start to record or to assess the knee range of motion for a right side for this particular subject. To keep a goniometer, as I said previously, we need three major important points, that is fulcrum, stabilizing arm, and movable arm. To mark a fulcrum or to mark a point where you will keep the fulcrum. For knee joint, it is the lateral epicondyle. Now, to palpate a lateral epicondyle of the femur, what you have to do is you have to keep your palm on the lateral aspect of the thigh and slide down below. Now here I can feel a first bony prominence which is called as a lateral epicondyle of the femur. So here with a marker I will mark a point to keep a goniometer. Once I have marked the point, then the fulcrum should coincide with a point which has been marked, and your stabilizing arm will point towards the, now the fulcrum should coincide with the point which has been marked over the lateral epicondyle here on the lateral aspect of the knee. Then your stabilizing arm is pointed towards the greater trochanter of the femur, and your movable arm will be parallel to the lateral aspect of the leg and will be pointing towards the lateral malleolus of the fibula. Okay? And once you are done this, you have to hold both the hands and take the knee into knee flexion. So here I am getting 130 degrees of knee flexion. So initial point where it is started is from 0. So it has 0 to 130 degrees of knee flexion in supine line. Now we have seen that we can do the knee flexion in supine line. Similarly, we can do it in prone line. So to do a knee flexion in prone line, again the initial starting position is prone line with you have to stabilize the hip and femur to carry out the movement at knee joint. Okay. Now to check the knee range of motion in prone line, the initial starting position is in prone line. Then you have to stabilize at the femur or a thigh, and with the other hand you will hold the ankle and do the passively knee range of motion. So here again you will get a soft end feel at the end of knee range of motion, flexion knee range of motion. So for again to check in prone line, where you have marked for the lateral epicondyle, there you will keep the fulcrum which should coincide, and the stabilizing arm should be pointed towards the greater trochanter, and the movable arm will be pointed towards the lateral malleolus, and again you will hold and take it into knee flexion. So here again you get a 130 degrees of knee flexion. Next we are going to see ankle range of motion. For the ankle we have pteroclural joint, that is which causes dorsiflexion and plantarflexion, and subtalar joint which causes inversion and eversion. Okay, now to firstly see to check the range of motion of dorsiflexion and plantarflexion. So the dorsiflexion movement is you have to stabilize at the leg, the tibia and fibula, and you have to take the foot in upward position. So it is causing the dorsiflexion, and the foot going into down towards the gravity or towards the floor is called as the plantarflexion. Now to check the range of motion at ankle for dorsiflexion and plantarflexion, when you do a passive range of motion, here you get a firm end feel because of the posterior structures, posterior capsule, and at the plantarflexion also you get a firm end feel because of anterior capsule and the structures. Now to check the range of motion at dorsiflexion and plantar flexion, we'll keep the fulcrum at the lateral malleolus and stabilizing arm at the lateral aspect of the leg, pointing towards the lateral epicondyle of the femur, and the movable arm is parallel to the anterior aspect of the fifth metatarsal. So here this is the initial starting position. So here we'll take it in the neutral position. To maintain the goniometer, you can keep 2 fingers in between the goniometer and the lateral aspect and the anterior aspect of the fifth metatarsal, and you can hold it here. So you have to grasp at the leg and at the foot and take it into dorsiflexion. Similarly, you can take it into plantar flexion. Okay, this is how you can check the range of motion. For dorsiflexion, the alternate position to check the dorsiflexion and plantar flexion is you can take the subject in prone line and flex the knee to the 90 degrees. Here you can see. Now you can keep the fulcrum on the lateral malleolus, the stabilizing arm on the lateral aspect of the leg, and again you can hold here, and movable arm should be parallel to the anterior aspect of the fifth metatarsal. From here you can go for dorsiflexion and plantar flexion range of motion evaluation. Now to check the inversion and eversion range of motion, what we have to do is we have to draw an imaginary line between the two malleolus, and the center point of it is the fulcrum for inversion and eversion. So here you will keep the fulcrum at the point. The ankle should be in neutral position. Then with the stabilizing arm, you have to stabilize the stabilizing arm, and it should be pointed towards the patella, and the movable arm should be parallel to the second metatarsal. Here you can do inversion and eversion range of motion for the subtalar joint. So we have seen how to check the range of motion for ankle dorsiflexion and plantar flexion. So the normal range for ankle dorsiflexion and plantar flexion is dorsiflexion, it will range from 10 to 15 degrees, and for plantar flexion it will range from 25 to 30 degrees. As well as we have seen the inversion and eversion range of motion at subtalar joint. So for inversion and eversion range of motion of subtalar joint, the normal range for inversion is 25 to 30 degrees, and for eversion it is 15 to 20 degrees. Okay, now we have seen both knee range of motion and ankle range of motion for this part. For the next part, we are going to see spine related range of motion evaluation, in which we are going to start with cervical range of motions. Thank you for watching this video.